You want the microphone?
For the introduction.
Yeah.
All right. Hi, everyone. Welcome. Welcome to the first Swedish equine educational series. I have these notes as a little cheating thing here, so sorry about that. I should have memorized it. Um, we're extremely excited to serve our community with knowledge and information from local. We have many talented people living here, and I felt it was a great idea to find a way to share it. So here we are. This is the first series, first episode. I don't know what you call them. And This evening, we are so grateful to have Dr. Megan Eick here, and she will be speaking about the most common equine emergencies and how to be prepared. Dr. Megan has served our area for almost 10 years with Cross River Veterinarian Services. And for you who knows Megan, Dr. Megan, sorry, like me, and know she has great talent and compassion. Talking from my own experience, she's been here for me in good and bad, and I'm always going to be grateful how she treats my horses. Um, like the time I had to say goodbye to my Vaunt. I mean, she's more than a veterinarian, you know. She's just a wonderful person. I also want to let you know about our next event on May 13. We will have a Farrier Hall, a Hall of Famer, Sonny Pastilli, come and talk about corrective shoeing and shoeing in general, and it will be very interesting. And I want to thank Sue Voorhees with Pampered Chef for being here today with her yummy food, and for Fiona for making the food you did as well. Thank you. And we're going to have giveaways here today. We have a beautiful first aid basket for Cross River, and Sue is going to give away some Pampered Chef products. We will draw the winners after the talk. Also, when Dr. Megan is finished speaking, we will have a Q&A. Okay, so here present Dr. Megan. Oh, good call, Jan.
Hi, everybody. So I'll tell you a little bit about myself. I grew up around horses. I spent my childhood obsessed with horses and barrel racing. I later went on to Delaware Valley University and I got a bachelor's degree in large animal science. Shortly after, I went to Ross University, School of Veterinary Medicine, and I graduated in 2013. I then went on and did a rotating internship at Mid-Atlantic Equine Medical Center, and I've been at Cross River Veterinary Service for the last 9 years. One of the things that we do at Cross River Veterinary Service is we provide emergency care 24/7, 365 days of the year. We rotate it between the vets, but we do see a fair amount of emergencies. So I felt like I could bring to you some of the most common emergencies that we see and kind of what to expect and how to kind of prepare for them. So the first one that I'm going to talk about is colic. If you're a horse person, you've heard of colic. You've probably seen colic. And so what colic is actually, it just means some abdominal pain in a horse. So symptoms of colic, it varies. Just like people, every person kind of responds to pain differently. Horses are very similar in how they respond to pain. So symptoms of colic can vary anywhere from a horse that's just not eating its feed, a horse that's just laying down, could be very mild. and they can be more extensive. A horse that's flipping its lip, pawing the ground, rolling, thrashing, and actually can be so severe that a horse will roll and thrash so bad that they'll actually injure themselves. They'll have scrapes and wounds just from rolling, and you'll have a hard time keeping them up. So those are some of the symptoms, things to look for a horse that's colicking. So one of the things that most people will know to do is to start walking the horse, and there's a lot of benefits to take your horse that you've gone out to feed and you've noticed that something is wrong, and so you'll start walking the horse, and that is a perfect thing to do. Walking has a lot of benefits. There's a few things that walking will help you with a colicking horse. It'll start to get the gastrointestinal tract moving. If they have gas, they'll start to pass some gas. They'll pass some manure. It'll take their mind off of rolling. So there's a lot of benefits to moving a horse that's wanting to colic. Other things that you can do, and things that we certainly want you to start thinking about, and if you're a new horse owner, I know with the pandemic we've had a lot of people go out and buy new horses, so we have a fair amount of clients that are new horse owners, as well as very well known and good horse people that have been in the business for a very long time. So one of the things that you can start to do, and we want you to start thinking about, is taking the horse's temperature. So take the horse's temperature. You can certainly, call your vet the instant you notice something is wrong. There's a few things we would talk you through and want you to start thinking about doing. One of those things, there's several questions we're going to ask you. So we want you to start thinking about these things and being prepared to do them. One is your horse passing manure? Two, is he drinking any water? When was the last time anybody saw your horse? So how long, to try to get an idea of how long this has been going on. So there's a lot of things that we're going to ask you, and things that we want you to be thinking about when you make that phone call is he passing manure? Has he drank any water? How long has this been going on? Has he ever had a problem before? These are the things that we want to know. And what this will do is it'll help us to know, and as well as what your horse is doing at that moment. And I kind of described some of the symptoms that your horse might be having. And for us, we can get an idea of how severe it is. There's a possibility that there's another emergency, and we're trying to make an order of which emergency should we be going to first. There's a chance that we're right down the road from you, and in an hour we might be farther away. So it's always good to call, and we can maybe help to talk you through the emergency and help you to decide if your horse needs to be seen by a veterinarian. The next step. So you certainly can give your horse Banamine. If you have a relationship with your veterinarian, you have Banamine on hand, you certainly can give it. I do advise that you call your veterinarian first, and the reason being is that, if we are 15 or 20 minutes away, we might say, we're very close, your horse sounds very bad, I want to come right away. I might want to give it IV Banamine if you only have the means of giving it orally. So there's certainly certain circumstances where we would suggest not. So certainly calling, and if it's something you think that maybe you can manage, and you don't want to vet out right away, we're happy to talk you through that. So next step, what to expect when the vet gets there. So there's a lot of different causes of colic, but one of the things that really helps us is the physical exam. So a physical exam will tell us a lot. Like I said in the beginning, horses will display signs of pain in very different ways. So a physical exam will help us to determine, is this horse just being a wimp and there's really nothing much going on here? Or is this horse very stoic and he's got a serious problem? So like I said, horses will display pain in many different variables, and a physical exam as well as a rectal exam and a nasogastric intubation is a way for us to determine what is going on and how bad this horse actually is. Because just going by the horse's pain level isn't always 100% way to figure that out. So physical exam, we'll look at your horse's gums. We'll assess the heart rate, a respiratory rate, um, GI, gut sounds, temperature. And another thing, we want you to take their temperature before giving them Banamine before we get there, because there are some types of colic that will cause a fever, and Banamine is a fever reducer. So we really want you to take the horse's temperature. So these are some of the things. And then a rectal exam, what we can do is palpate we can't palpate all of the GI tract, but we can get a good sense of what's going on. And as I said, colic is just abdominal pain. So most of the time it's gastrointestinal, but a mare in heat could have ovarian pain and she could be colicking. So there are other causes of colic, or horses that are displaying symptoms of colic that aren't necessarily gastrointestinal. So these are the types of things that we do and assess to be able to figure out why your horse is displaying those types of symptoms. So I talked about kind of what to expect. So I'll kind of reiterate what to do. So certainly walk your horse when they're colicking. Take their temperature. You can certainly give them Banamine, but put a call into your vet. Like I said, a lot of different causes of colic. It can mean anywhere from something mild to where it's just gas that's moving through and they're having a little bit of gas pain, to something that's more drastic, an impaction because they didn't drink enough. So now they're a little bit constipated. To more severe things would be like a twist in their intestine. Those are much less common, but there's a couple things that would indicate that, which would be an elevated heart rate and pain levels that we can't seem to quite control, but definitely less common. So just a fun fact about horses, their large colon takes a lot of twists and turns. So a large colon goes from here, it actually narrows, and we get to a pelvic flexure, and then it twists this way and comes back up this direction. So Ingesta is supposed to do that. Not to mention they have 70 feet of small intestine. So horses are that's why colic is number one on the list. Horses are, I'm not saying that horses are an accident waiting to happen, but they kind of are. So that's why horses colic. And sometimes there's not a big reason why horses colic, but they do. It's hard to figure out or get to the bottom of it. But colic is certainly number one on the list, and that's why. So I guess I'll move on to the next one, fever. So I would say colic and fever are kind of neck and neck. Fever is a big one. Fever can sometimes look like colic because remember I said with colic, they may just be laying down. And for a fever, they may just be laying down. And that's why with colic, I told you to take the horse's temperature. With the only way you're going to know it's a fever is to take the horse's temperature. Always take the horse's temperature. I'm not here to rant, but take the horse's temperature. I should be giving out thermometers. So with fever, there's a couple things that you'll notice. Sometimes the horse just won't be eating. If the horse isn't eating, I mean, sometimes, you'll throw everybody's grain in for the evening, and then you'll notice somebody's standing at the back of the stall, or maybe they're a little bit lethargic or just not quite right. And that would signify you to take the horse's temperature. Always have a thermometer on hand. And for new horse owners, it's just a regular human thermometer. So go right down to the CVS or the Rite Aid and pick up just a human thermometer. That's your best bet. I can't tell you how many emergencies there's been. It's 11 o'clock at night. The local CVS is closed and people can't take their horse's temperature. If you can't take your horse's temperature, I have to come out. Definitely have to come out tonight, because if you can't take your horse's temperature, somebody has to take your horse's temperature. I'm coming out. So keep it on hand. Keep a thermometer on hand. So for fevers, they may just not be eating. Take their horse's temperature. What it means is they have an infection. So there's a few things to expect when the vet comes out. A lot of times we'll want to run blood work. What the blood work will tell us is it'll give us a white blood cell count, and that'll help to indicate what kind of infection we might be dealing with. But there's a couple of questions that we'll be asking you. So there's a few things I want you to start thinking about. Has your horse traveled? Has he gone anywhere? Are you at a boarding facility and there's new horses coming and going? Have they gone anywhere? I want to know its travel history. Not to mention, has your horse passed any manure? Has it drank any water? So kind of the same thing with colic. So not only do I want to know your horse's history to try to get an idea if this might be something that's contagious, so I can start working through some of that. And also, is it having any other symptoms? Is it coughing? Does it have nasal discharge? Does it have diarrhea? Are there other things that might be causing the fever? But as well as, what is the travel history, or are there any other sick horses on the property? So those are some things I start to think about to try to figure out why it might have a fever, and I take that in consideration with the blood work. Sometimes it's just a fever and you're not seeing any other symptoms, but that also helps to guide us in one direction or the other. So when we call, these are the types of questions that we'll ask you. So it's important to start thinking about looking around your horse's stall. Be aware of the area. People that have been doing this for a very long time, I think, kind of do it without even thinking about it. But is your horse passing manure? Is he drinking water? What is he acting normal? How is he not acting normal? What are the differences in how he's acting? So that would be number 2. Number 3, emergencies, I would say, is choke. Choke is a big one. So how do you know your horse is choking? Well, I would say the most common scenario is you just brought your horses in from the field for the day, and all of a sudden you've noticed that one horse isn't eating, and now he has feed material and mucus just pouring out of his nose, and there's a big puddle on the ground. So that's what we see with choke, is it's just pouring out of their nose. And what you'll see is a retching or gagging response that's going down the neck. Okay, and they'll do that repeatedly, and it'll just kind of shrivel right down the neck. So usually the reason why horses choke, there's a few reasons. One is they may just be eating too fast. So they take that big first gulp of food. They don't know if a neighbor is coming to steal their food. For whatever reason, they decide to eat very fast, and they have a very long neck. So feed material gets stuck somewhere along there. It can be high, it can be in the middle, it can be low, anywhere along the esophagus, and cause a blockage. Some horses actually don't know enough to stop eating after it gets blocked. So the best thing for you to do is to actually remove the food, take it out of his stall, and to keep him as quiet as possible. Keep the horse quiet so that they'll panic. Sometimes a horse that's choking, they'll throw themselves on the ground because they have no idea what's going on. It's the first time they've ever choked, and they are freaking out, and they're laying down and flipping their lip and don't know what to do. So you can see kind of crazy response from a choke as well. I will say that most chokes resolve before we get there. So sometimes what we'll do is we'll say, everybody relax, calm down, take a breath, take all the food out of the stall, and we'll, yeah, thank you. Take all the food out of the stall, and we'll give it 20 minutes, 30 minutes, and you can massage the left side of the neck in the jugular groove, just rubbing your hand downward, and see if it'll resolve on its own, because 9 times out of 10 choke will only last for about 20 or 30 minutes. With that being said, if you let them go on for too long, you have an esophagus that's just spasming around this food bolus. So if you're waiting hours, by that point, it could be very challenging to get it resolved. So there's kind of this time window where I say, okay, half hour, 45 minutes is long enough. We need to see this choke. So kind of what to expect when the vet gets there is what we'll do is sedate the horse. I will tell you that a choke isn't a blockage of the esophagus. There are two holes in the back of the pharynx. There is an esophagus and there is a trachea. I have some people that think they can resolve a choke by syringing water in their mouth or putting a hose in their mouth. If the esophagus is blocked, the only other place that the water can go is down the trachea, in which case they will aspirate. Okay, and that's the same problem if a horse continues to eat after the horse is choked. Okay, so don't do that. The benefits of sedating a horse that is choked is that they'll put their head down and all of that food and mucus feed material can actually run out, and so they're not aspirating and getting feed material into their lungs. So we'll sedate the horse. We'll sometimes give them muscle relaxers to help relax the muscles that are around the choke. Banamine to prevent inflammation of the esophagus, because once a horse chokes once, there's a good chance that there will be inflammation of the esophagus and that they'll choke again. So it can actually turn into scar tissue or a stricture, in which case they'll choke again. So that's another important thing to get on board. And then the last thing, we'll pass we call it an NG tube. What it is we'll take a tube and we'll pass it up the nose, down the esophagus, and pump water into it to try to break it up. There's two ways that a choke can go. The choke can either come back up or it can go back down. So it has to go one direction or the other, but warm water is what helps to resolve the choke. So that is the way to do it. Old horses choke more than young horses just because they have bad teeth and they are not likely to chew their foods well. So that's having a regular dental does help, but old horses will never have a young horse teeth. So one thing you can do to help prevent choke if you do have a choker is to put water on the food and make it a nice slurry mush so that when they're swallowing it, it's not a big glob. That's one thing. If you have a fast eater, I have people actually take a rock or something and put it in the middle of their feed tub to actually help to slow them down. Do we have time for more, or should we go into question and answer? I can talk a lot about things that I'm passionate about, so, even though I'm not a big talker. I can keep going. All right, I'll go into the next one. I couldn't really pick those. Those are definitely the top three. A fourth one, it would definitely be a little bit challenging. I guess I would call it acute non-weight bearing lame would probably be number 4. So that's when you go out to the barn and your horse really isn't putting any weight on one foot, and there could certainly be a lot of causes of that. But I would say that hoof abscess is the most common. So I'll talk to you a little bit about what you can do to prepare for that. So how do you differentiate a hoof abscess from something more dramatic? Well, I mean, how do you know that there's not a fracture in there, an infection that's going toward the bone or up the leg? I think that that's a little bit difficult to discern, but I would tell you that most of the time it's a simple hoof abscess that is going to come out of the bottom of the foot. But things that you can start looking for, you can certainly try to get better at appreciating digital pulses, although it's a very challenging thing to do. But a digital pulse is something that you can start to find around your horse's fetlock. There's actually arteries there, and if you gently put your hand there, you can maybe start to feel some pulses in the foot. That generally indicates that there is some hoof pain. You can feel for heat, or you can actually look at the bottom of your foot and see if you're seeing anything where gravel may have gone into your horse's hoof or pus may have come out. So those are some things that you can kind of look for. But hoof abscesses, horses are extremely sore. So the treatment for that is warm water and Epsom salt bath, followed by, there's a lot of different things you can put on a horse's foot to help as a drawing salve. Poultice pads. Swedish Equine sells great poultice pads that you can put on the foot. Ixamol, sugardyne, million different revenues that you can put on a foot as a drawing salve to help to draw. And it's what it is it's an infection in the foot. Because horses are out in this environment, it's wet, there's rocks, little infection gets into the sensitive tissue where things don't belong, and it's a recipe for an infection. So that would be number one. What to expect with a hoof abscess is that it should be healing within 7 to 10 days. You should either see something breaking out, or your horse should be walking better. If it's not, we need to x-ray it, because abscesses go the path of least resistance. Hopefully the path of least resistance is at the bottom of the foot or at the coronary band. Occasionally it goes toward the bone, in which case then we have a bone infection, and we need to figure that out. We need to figure out if your horse has a bone infection. Other biggest rule out is a coffin bone fracture. So I guess the other thing is, did the horse come up lame during riding? I mean, that would make me more think that it would be a fracture or something that's more imperative that we see right away. But most of the time, run of the mill, it is a hoof abscess if you've gone out in the morning and now your horse isn't walking on its foot. So it's never wrong to be, proactive and wanting an x-ray. So if things aren't going smoothly, you're not really sure what's going on, you certainly can have your farrier out too, and they're very good at assessing it or digging abscesses out. But we can always take an x-ray and see, try to get to the bottom of why they're lame, and make sure that it's not those other things. Next one on the list, eyes. If your horse has a swollen eye, it's an emergency. It is an emergency if your horse has a swollen eye. They can go blind very quickly, very quickly. If it has two swollen eyes, it may just be allergies. It's probably just allergies if it has two swollen eyes, unless it's an Appaloosa. If it's an Appaloosa, we need to see it. But if it has two swollen eyes and it's not an Appaloosa, it's probably allergies. If it has one swollen eye, your horse can go blind pretty quickly. What to expect? I mean, we need to do an ophthalmic exam with a corneal stain. So what a corneal ulcer is a scratch of the cornea, but they can get infected fairly quickly. And if they get infected, it could be months of you treating that eye to get that infection under control. So it's something we need to address and get on board, pretty quickly. Eyes, you don't want to mess around with eyes. You should always call. Lacerations, I guess, will be my last one. We see a fair bit of lacerations. How do you know if a laceration or a cut or a wound of any sort should be seen by the veterinarian? Well, if it's over a joint, it should be evaluated. If you have a joint infection, it's a whole different ordeal than just a run-of-the-mill cut or wound. That's in cartilage of a joint, and you have a whole nother ordeal on your hands. If it's on the back side of a leg toward the tendons, we would like to evaluate those tendons and make sure that there's not a lot of damage done. Um, Lacerations by the eyes are a big one. We see a lot of ripped eyelids. Those should be sewn back together, because your horse has glands in the eyelids that are very important for fly control and keeping that eye lubricated. Um, Anything that's deep, we can certainly stitch. Um, Anything that has a lot of excessive uh, drainage, if there's a lot of drainage from the wound, we should see it. If it's starting to stink, we should see it. Those are the types of kind of lacerations that we should see. So I guess that's kind of my final topic. So I guess for now we'll go into some question and answer. And I don't know if we can do Facebook Live question and answer too. Can they?
You know what? People can ask questions. Yes, absolutely. And I can see what they say. And
Okay. We'll start here, and then we'll let you work on them and let you can ask as well.
A little bit about laminitis, especially given this time of year.
Sure.
And things that were always like heat in the hoof, which you don't always find. You know, things are. Can you talk a little bit about laminitis?
Yeah. So for people on Facebook, the question was to talk about a little bit about laminitis, especially this time of year. So what laminitis is? Inflammation of the lamina. What the lamina is it is the part of the hoof that connects the hoof wall to the coffin bone, like Velcro. For horses, that is their shock organ. If something goes wrong, if their insulin is elevated or the glucose is elevated, unfortunately, the lamina is what takes the hit on that. So this time of the year, with the grasses coming up, any horse that is insulin resistant or has a metabolic issue is going to have problems with the grass, because the grass has a lot of carbohydrate in it, and it'll spike their insulin. So yes, we certainly see heat in the hoofs. That is a primary thing. So if you have, so a few things to look at and to think about is, one, what breed of horse do you have? So there are certainly breeds of horses that are predilected to developing metabolic syndrome. One of them is the Morgan, draft horses. We see it less commonly in quarter horses and paints, although it can exist. We see it in ponies and we see it in minis. So those are I would say, the most common breeds. And what it is the horses are becoming overweight. You generally, not always. We see it in saddlebreds, and saddlebreds can be very thin and still have metabolic syndrome. So it's what's happening is there's a lot of insulin in the blood, but the receptors at the cell level are not responding to the insulin in the blood, and it's not utilizing the glucose, and it's sending a signal to the feet, which are the shock organ, which is causing laminitis. So how a laminated horse would present is that you'll go out someday and they'll be almost walking on eggshells. They're like rocked back, their feet are out in front of them, and they're eggshelling around, typically is what we'll see. And that would be a more severe, could be lame on one foot, could be worse than the other, and they can look one-sided for sure. But generally you'll feel elevated pulses in both front feet, and you'll feel heat as well. So a few things you can do is, one is you need to starve them. It's come from grass. It's come from carbohydrate overload. They're probably overweight as it is, chances are. And they need to be starved. You need to take all of their food away. Their grain has to go away. Their hay has to go away. They need to be on stall rest. So once they get inflammation in the lamina, that there's two things that you need to do. You need to control them metabolically, and then you need to control them mechanically. So metabolically is why we're doing that by eliminating the food in the diet. Mechanically, we're doing that by restricting their movement, because once they have inflammation there, the more they move around, the more that coffin bone is likely to rotate. So once there's inflammation in the lamina, that coffin bone can rotate right off of the dorsal hoof wall, which is acting, like I said, the lamina is acting as a Velcro to hold it there. So stall rest, icing helps with the inflammation, anti-inflammatories to help with the inflammation of the lamina. Like I said, restricting movement, restricting diet. So those are the big things. I don't know if that answers your question or if there was anything else. Yeah, absolutely. Yeah, so yeah, definitely be conscious if your horse is overweight. If you're having one of those breeds that I mentioned, I think Morgan saddlebreds, minis, drafts, those are the big ones that typically get that. But you can certainly, as a preventative, get your horse's blood work checked. We can do a metabolic panel and see what your horse's insulin levels are before the grass is lush, before we get into that, if you're having concerns about laminitis in your horse's weight. So those are some things you can certainly do. Any other questions? Is there, so the question for the Facebook people, the question is there a point in a colic where you can overwalk? Yes, there is. There is. There are some horses that are out of shape, and the horse is colicking, and now the owner has been walking the horse for 2 hours. The horse cannot walk for 2 hours. It couldn't walk 2 hours yesterday. It can't walk 2 hours today. You can overwalk a horse. You can. If it's colicking that long, chances are the horse has a very bad colic that needs to be addressed. It could potentially either be surgical or need to be needing referral. But yeah, you can overwalk a colic to the point where the horse will tie up. If they're not in shape, you just can't walk them for a very long time. You're safe to walk them for half hour to an hour. Yeah, you can overwalk them. Absolutely. Good question. Very good question. Anything else?
What is the differences between the signs of ulcers and colic?
Yeah, so the question is, what are the differences between signs of ulcers versus colic? They're interchangeable. So again, colic just means abdominal pain, and I mentioned that a mare that's having ovarian pain could be colicking, but a horse with ulcers could also be colicking. So very similar. I would say that the biggest difference between a horse with ulcers versus other types of colic would be that horses with ulcers don't like to eat grain. So a lot of times they'll colic during an episode of eating grain. So they'll prefer not to eat the grain because the grain produces a lot of acid in the stomach, in which case they'll prefer the hay. My experience has been that Banamine helps horses, like they feel better after they Horses with ulcers feel better after they get Banamine, but once the Banamine wears off, they'll sometimes colic again because Banamine will make ulcers worse. So, just because it decreases blood flow to the stomach, in which case. So, certainly ulcers are on the list anytime we see a colic. So, we see, if we're seeing a colic, ulcers are on the list, gas colics on the list, impaction, um, gastrointestinal displacement, all those things are on the list, and those are the types of things that we're trying to rule in or rule out to try to get to the bottom of it. Go ahead.
With the new types of ticks and the new varieties of Lyme disease, are the symptoms different? Are we treating the new types of the Lyme stuff the same as we normally do? And is our area more prone to these new types?
Yeah, so the question is, are we treating the new types of Lyme disease the same as we were treating the old types of Lyme disease? The answer to that is yes. Borrelia burgdorferi is the bacteria that causes Lyme disease. And we know that it responds to several antibiotics, doxycycline, Xceed, and oxytetracycline. So those are the three antibiotics that we typically, minocycline, there's a list of antibiotics that we use to treat doxycycline. And as far as the studies show and what we know, that is the best treatment for Lyme disease. We do see an awful lot of Lyme disease in our area. The symptoms have been the same. Yeah, I will say that symptoms among horses can vary. We see some horses with very high titers that the owners really haven't noticed a difference, and that there's a lot of horses that I pull titers on every 6 months, every 3 to 6 months, and we treat them just based on the titer. There are other people that they'll notice horses grumpy, they're more sensitive when they brush them, they're to the extent of horses being lame, horses being bucking them off, just having just more severe symptoms. But Lyme disease in horses varies. It varies drastically among horses. But as far as what I've seen, they've been the same.
So it's going to be worse this year since we didn't really have a bad winter.
I would say, yeah. Anything else? Yep, go ahead.
Vanity.
Yep.
Is that something you recommend people to have?
Yeah. So.
My question
Yeah.
is, do you do it IV or IM?
So the question is, Banamine, do I recommend people having that on hand, and do I recommend it IV or IM? I will start with, I recommend that everybody have a good relationship with their veterinarian, first and foremost. With that being said, there's a lot of benefits to having a good relationship with your vet. When you have an emergency situation, you guys will kind of everything will work out better for the horse because everybody's expectations will be on the same level. The communication will be better. I admit that I have clients that call me and I'm like, oh, this person's, she knows exactly what she's talking about. I've known her for 100 years. She's great. This, if she's got a concern, it's a really big concern, And then there's other people that I've not seen or talked to in many years, and I don't always know that we're on the same page or that I'm really understanding the emergency. So it's very good to have a relationship with your vet. And certainly if we're coming out regularly and we do your vaccines, I do recommend having Banamine on hand. There's a really good chance you're going to run into an emergency at some point. Having Banamine on hand can prevent you from having the vet out, which is extremely expensive. If there's something we can talk you through and get the horse through the emergency over the phone, which a lot of times will require Banamine, I do recommend that you have Banamine on hand. Banamine should never go IM. There is no type of Banamine that goes IM. Not the injectable only goes IV. There's oral Banamine. If you can't give an IV shot, I recommend you have oral Banamine on hand. So if there's a fever, if your horse has a low grade fever and you can give it Banamine and it's eating and drinking and feeling fine otherwise, and we can come out the next day, and you want to avoid the emergency fee and I don't have to leave supper, I think everybody's generally happy. It has to be IV or oral. So those are the decisions you make when you purchase Banamine from a vet is, can you give an IV shot? If not, then we recommend oral.
But the oral, the one that you use in the vein, you can shoot it in the mouth.
Yes, exactly.
It doesn't have to be a different type of Banamine.
Yeah, so the question is, can you give IV Banamine orally? Yes, you can. All you do is take the needle off and give it in the mouth. And it's much cheaper than the oral Banamine. It just tastes bad. Go ahead.
I know, but can you explain why iron Banamine is not recommended?
Yeah, so the question is, why is IM Banamine not recommended? It causes clostridial myositis. There's been several cases where people that have given IV Banamine in the muscle, where the horse will get a bacterial infection and blow up the neck, and it is a disgusting mess. It's a disgusting mess, and you don't want to take that chance. It's not worth the risk. Anything else? I got another one back here.
Is Banamine recommended for minis?
Is Banamine recommended for minis? Is the question. Yes, it is. Minis are really no different than horses, and I prefer Banamine over Bute for most things for minis because we can dose Banamine better for minis than we can Bute. Banamine comes in a nice, delightful paste where we can screw down the poundage right down to 250 pounds, which is what most minis are. For Bute, the Bute paste comes in 1 gram. 1 gram is for a 1,000-pound horse. You can't do a half a gram on the paste. The powder is an eyeball of a scoop, which is designated for a 1,000-pound horse. So I prefer Banamine for minis in most cases.
Okay, why I asked that, I have a mini that likes to college. She likes to get us all worried, and she's been down to Mid-Atlantic for a week and everything. I didn't need surgery, knock on wood. But my friend makes up a oral Pepto-Bismol and Banamine, and she a couple times that kept me from having the vet after.
Yeah.
That's safe. I mean, my vet was like, you shouldn't do that. I'm like,
Well, I don't want to speak for your vet. I mean, I will admit that Banamine fixed most colics. It really does. Most colics are simple gas colics. They have some gas that's got to go through and come out the other end, just like people. That is 9 times out of 10, your most typical colic is a gas colic. Banamine helps because it's a pain reliever. Could do a lot of colics get better without even getting Banamine? Sure, absolutely. So yeah, I think it's a fine thing to do. The ones, the colics that are a problem have already gotten Banamine and they're still painful. Those are the colics that we know are surgical. Those are the colics we know that aren't going to make it. Those are the ones that are life threatening. So if you've given your mini Banamine and it's gotten better, then chances are it's just something simple that was able to resolve. I mean, the important things of after giving Banamine is, like I said, is the mini or the horse, is it passing manure, is it drinking water? So you can certainly give it Banamine and it feels better, but if it wasn't drinking water and it's got an impaction, it's important to get that mini drinking and not just stuff it with hay so that the impaction gets worse. So you got to make sure it's doing those things, and that's why I kind of mentioned taking its temperature, assessing the manure production and the water intake.
Yeah, that's what I say. We got her through. We had the war, then we're happy.
Yeah. Yep, absolutely. Yep, go ahead.
Okay. I'm wondering if you could talk, and I can't remember the name of it, for anybody else living between two streams that has mayflies, caddisflies, and everything else, and had an episode with my horse 6 or 7 years ago where I can't remember the name of it. Looked out and he's walking sideways, and I'm thinking, oh my God, I'm falling off the work. But it was something caused by bacteria
Yep.
in the stream flies, and how important it is to scrub feed buckets and water buckets and turn them upside down, because I thought I was going to have to put my horse down because of that issue with mayflies, caddisflies.
Yeah, so this woman says that she lives between two streams and she had a problem with her horse and she had the vet out, and the problem was caused by caddisflies and mayflies. So there is one bacteria that causes a problem that's caused by caddisflies and mayflies, and that's Potomac horse fever.
It wasn't the Potomac though, because that was my first fear. That was, oh my God, I have to put my horse down.
It's then
It was something completely different, and they were very.
yeah, I mean we sometimes see increased cases of anaplasma.
Okay, it might have been that. It was so many years ago,
Yeah.
I can't remember the name, but it was one of those situations where I thought, oh my God, my horse is going to
Yeah,
have to be put down.
I will say that fevers the horse can look almost drunk. There's sometimes horses can have fevers that are so high that they will walk sideways and do crazy things that once the fever is resolved they'll stop doing, unless it's something else neurologic that you might be talking about.
He didn't have an excessively high fever. It presented like.
Yeah, EPM would be the third one.
Yeah. But it was all due to the stream flies.
Yeah.
And the bacteria that they carry, and they treated him, and it was done within a couple of days. But it's also something we look out and think, oh my God, I'm going to have to put my horse down.
Yeah, that's scary for sure.
But no, it was probably 7 or 8 years ago now. But yeah. So anyway, clean the buckets.
Clean your buckets. Go ahead.
Well, Ehrlichia is from tick, right?
Yeah, so Ehrlichia is the old name for anaplasma. The names are used interchangeably. We're trying to get away from Ehrlichia and getting more toward anaplasma, but it is the same exact thing. But it is from a tick. It is the same tick that carries Lyme disease, and it causes a fever in a horse. When I was going to vet school in Minnesota, we saw more severe cases of anaplasma where horses would get really high fevers and they'd have edema in all their legs and they'd be like, knocking on death's door, like they looked horrible. But I will say that the strains around here and now the strains are much less severe and they're more mild. A lot of times what we'll see is just a fever, and the horse will have no other symptoms. They don't usually have a cough. They don't have a nasal discharge. They don't have diarrhea. They don't usually have any other symptoms. They don't even have to have travel history. They'll just have a fever, and typically the reason has been a tick-borne anaplasma. They respond very well to antibiotics.
EPM real common around here.
EPM is very common. EPM, if we tested every single horse in the state of Pennsylvania, New Jersey, Maryland, 90% of them would be positive for EPM if we did just a titer. This, which just means a titer just means that they're exposed to EPM, which doesn't mean they actually have the infection. EPM is a very challenging thing for us vets because we can just do out in the field, we can just do a blood test, and the blood test just indicates exposure to EPM. It does not mean that they're clinically infected. That's another reason why it's important for us to do a physical exam or a neurological exam and seeing if they're having any neurological deficits. A lot of times what we'll recommend if you really think your horse has EPM is to go to a referral center for a spinal tap. That's the only true way to diagnose EPM. The other thing you can do is just treat your horse for EPM, but it is very expensive to do that. But EPM does live in the environment, it lives everywhere, and horses certainly can ingest it.
If a horse has got all the clinical signs and neurological signs of this, is really there a way to bring the horse back, or is it pretty much a death sentence? If it's truly neurologic and the whole nine yards.
Yeah, so truly neurologic. We usually give neurological symptoms grades, grade 1 through 5. So what we know about EPM is it's caused by a protozoa. After we treat horses for EPM, it gets rid of the protozoa. But the protozoa cause damage to the spinal cord. If they cause damage to the spinal cord, typically horses only get 1 grade better. So we can clear the protozoa, like I said, but their neurological symptoms don't disappear. They usually just get a little bit better. I will say that if a horse truly has EPM and they have a lot of protozoa in their bloodstream and they're very infected, a lot of times they'll get worse before they get better. They'll get worse after treatment because they have this shower and their neurological symptoms can be very bad. They can get very bad before they get better. I don't necessarily want to call it a death sentence because if they're only mildly infected with EPM, like a grade 1, they may stay at grade 1, or we might get them 100%. But if they're like a grade 5, which is very neurologic, we may get them to a 4, but we're never going to get them perfect again. So it kind of depends on what the lifestyle is of that horse. It depends on if that horse is dangerous to the people around. If the horse is very dangerous and doesn't know where its feet are and it's falling down and its feet are landing toward you and you have a young person that's not very horse savvy that's working around the horse, well then you may have to think about making a decision to keep everybody safe. But if the horse, like I said, if it's mild, it shouldn't affect their long-term life, as long as they're not a Grand Prix jumper. Anything else? All right, Karina, you're on.
Thank you, Megan. Thank you so much.
You're welcome.